Myeloproliferative disorders are characterized by a clonal hematopoiesis, especially at the CD34 stem cell and also progenitors. The expansion of those abnormal cells are responsible for the symptoms and signs characteristic of those illnesses that are basically some systemic symptoms, splenomegaly, anemia, cytopenias, and they all concur with the development of the illness to um, uh, a severe marrow fibrosis and also bring into transformation to acute leukemia. We have a pre and a post era in the treatment of those illnesses that were represented by the identification of JAK2 abnormality and JAK2 inhibitors drugs. JAK2 inhibitors drugs are in fact the only drugs, the first drugs that could modify the symptoms and signs related to the illness and also reduce the splenomegaly. It is true, however, that not all patients can do JAK2 inhibitors drugs because especially of cytopenias that are already present, and also that portion of those patients will not respond or respond initially and then have no benefits with the time as the time goes by. As a matter of fact, more than 50% of those patients stop treatment with JAK inhibitors after the first 3 years, and also patient that stops treatment with ruxolitinib in the specific settings have a disappointing survival outcome. It is true then that we need to move from symptom controlling to disease modifying drug, meaning that we need drugs that can modify the mechanisms that are at the basic of the development of the illness. It is true then that JAK inhibitors have a modest, if any, disease-modifying efficacy, and we are starting to explore all the other mechanisms that are not related directly with the JAK-STAT pathway that can intervene and that are modified in those patients. So there are drugs that can intervene at the epigenetic level, at the signal transduction, the microenvironment that can act blocking the telomerase activity, and also some other transcriptional mechanism. Those small molecules are used mainly in association with JAK inhibitors, and they seem to have promising results, especially from the fibrotic point of view. So it seems that those small molecules can act together with JAK inhibitors, or also after JAK inhibitors have failed in modifying the mechanisms that are directly connected with the disease progression. Probably in the future, we're gonna focus our attention not only on response to symptom and splenomegaly, organomegaly, but also on overall survival. And since those drugs seem to have very promising activity, we really hope that this can be the future.